The government changed early in the year, but the resolve for a healthy and prosperous nation was unwavering. This is the Health Year in Review, as captured through our lens.
A World Bank-led benchmarking cost review has commenced. This will facilitate taking the necessary steps to reapportion expenditures to ensure the greatest levels of efficiency.
Government maintained its no-user fee policy in 2016, but also made this policy move.
I signed an approval for the gazetting of revised fees to be collected from private insurers who interface with the public health system.
The National Health Fund, meanwhile, doubled its medication subsidy to children enrolled in the program. The Health Ministry delivered a number of infrastructural improvements in 2016. A memorandum of understanding was signed for the upgrading of the Alexandria Community Hospital in St. Anne. Another was inked to develop the Jamaica Children's Heart Center at the Bustamante Hospital for Children. A $63 million contract was signed for the final phase of major construction, drainage and electrical installation at the Isaac Barrett Center of Excellence in St. Thomas. The Percy Junior Hospital got an improved driveway, parking area, security post and new chain-link fence. 3 renovated wards were reopened at the Kingston Public Hospital. And the ministry broke ground for the construction of a state-of-the-art cancer treatment center at St. Joseph's Hospital. In 2016, the National Health Fund provided $68.5 million to purchase a new fluoroscopy unit for the Bustamante Hospital for Children.
Modernizing our approach, modernizing our equipment is fundamental, and today I think is the start of that process.
6 referral hospitals received maternal and neonatal high dependency units under the program for the reduction of maternal and child mortality.
The equipment being provided will facilitate highly specialized radiographic technology, critical care ventilation, and specialized patient monitoring.
And after Cabinet approved the Charities Policy and Procedures Guidelines for gifts and donations to the Ministry of Health, the donations poured in. $2 million in pharmaceuticals from Issa Trust Foundation. 26 hospital beds from Wray Nephew and Food for the Poor. A blood gas analyzer machine and advanced patient monitors from Guardian Group Limited. An Optical Coherence Tomogram for KPH from Church of the Latter-day Saints. 1 delivery bed and 2 Cardiotocograph for Victoria Jubilee Hospital from NAJ UK Chapter. 1,100 wheelchairs from the Errol Rattray Evangelistic Association and Jamaica Mobility. Surgical equipment for Mandeville Regional Hospital ENT Department. Plus cardiac monitor for Maypen Hospital from Jamaican Canadian Association of Nurses. The country had to contend with a number of public health risks in 2016. The UWI Microbiology Lab completed a $10 million upgrade to test for the Zika virus and other pathogens.
The waiting period to determine infection has been significantly reduced because previously cases had to be sent overseas.
National cleanup activities, fever and rash surveillance, house visits and a fogging blitz were among the measures employed to fight Zika. There were also targeted interventions to protect pregnant women and their babies. And as the flu season approached, the ministry took a policy decision to make the flu vaccine available to a wider group of Jamaicans. In 2016, the Ministry of Health successfully tested a prototype to reduce patients' waiting time in hospitals.
What is happening, I am told preliminarily, the reports, is that the 2, the 3, the 4 and the 5-hour extension in some cases of those clinics is taking the pressure off the accident and emergency room. And that is exactly what we want to achieve.
The Ministry of Health in 2016, setting the foundation for a healthy and prosperous nation.